Call them up. Health
Let me
Department,
just get the
DSS.
transcript going and the recording,
How much revenue?
and then we'll be ready to roll.
Yeah.
Just leave it like that if you can, because we want it to be open, so.
Really? Come on.
I'm just, I didn't know you sick.
You're 3 times bigger than you are.
Okay, so Janal can hear us, so I think we can get started.
Okay. Hi, Denal.
He
Hello,
can't talk.
Supervisor Eldridge.
He can see us, but he can't talk.
So I'm filling in. I'm the co-chair.
Welcome to know.
Thank you. I'm the co-chair, Health and Human Services Committee meeting agenda for February 14th, 2023. I can't believe it. Happy Valentine's Day. So I'd like to call this meeting to order. Okay, so I have departments reporting. Health Department. Come on
Right up in the middle there.
Come right on up.
Everybody,
You're in the hot seat.
How are you?
I'm pretty good.
Good, good.
No. Start with my first resolution, a request to authorize to declare a vehicle surplus.
Move it. Second.
All in favor?
Aye.
Any discussion? So carried.
Next is a request to authorize the Director of Children with Special Needs to bid, award, execute, and adjust transportation contracts.
I'll move it. Second.
All in favor?
Aye.
And so carried.
Next, a request to authorize the renewal of contracts listed on appendices A, B, C, and D.
You understand moving?
Yeah.
I'll second.
Who moved it?
Dave.
it.
Oh, I did. All in favor?
Aye.
Any discussion on anything? All right, we'll move it.
And next, a request to authorize to modify budget to accept additional funding. I'll move it.
Second.
I'll second.
Okay, all in favor?
Aye.
Discussion? So carried.
Request to authorize to contract with Jack Mab as a professional consultant for public health services.
Is there a, I'm sorry, is there a
Yeah.
maximum annual?
Yes.
Yes, it schedules
Concerning
B
the-
has a
Yes.
compensation, yeah.
I think Matt.
That would, yeah,
I'll second it.
that's standard to what we've done. with them.
Right, I just wanted to make sure.
Matt moved it, who
I
seconded?
did.
Okay, all in favor? Any
Aye.
issues? Okay, so carried. Move, order, there we go. Next,
Request to authorize to carry over funding on multiple grants from 22 to 23.
all in favor?
Aye.
Discussion? So carried.
Oops, there's lots.
All
All right, and then you do have a conference objective.
Outside of state.
Yes.
Yeah.
23 preparedness summit.
And the cost is
$839.
The reason why it's brought to committee is because it's out of state.
Yeah.
And we need committee approval for
I'm
it.
assuming that a pretty good budget.
Yes.
Is one person, Jack?
Yes.
It's actually John, the
John,
son, right?
John, yeah.
I'll move it.
Second,
I'll second.
any further discussion? So carried.
And then the director's report. Overtime is under budget for January. Surprisingly, in January, didn't get any new septic applications. With 2 rabies submissions, 1 negative bat and 1 positive skunk.
Who caught the skunk?
Not me.
Poor person.
I know.
Unfortunate.
Anything else you
They
wanna-
got bit by a skunk?
Not a human, but
Oh, okay.
it did attack a dog.
Oh, okay.
The dog's all right, but it is going through the
Treat.
quarantine and, yeah.
Huh.
So we'll follow up on that in 45 days.
Skunk with the dog. Now, what if a dog catches the skunk and, does that shaking? What happens then? Is it the same thing if they break the skin on the skunk, right?
Yeah, well, yeah. So any
Okay.
scratches or anything to the animal.
From the skunk, gotcha. Okay, thank you.
And we also did one pre-exposure rabies series and one post-exposure series in January. On a human. Flu is still widespread for New York State. This week marks the 18th consecutive week, although our cases are at a much more reasonable level now than they were at the end of last year, and we were really concerned about flu and RSV. So it's encouraging. The WHO announced on January 11th that the Uganda Ebola outbreak has ended. We have one case that we were tracking. I think that was back in December, so that person is cleared now. So that's good. Anyone's interested. So COVID numbers. We did have 6 deaths in January, unfortunately. So that's quite high. Our hospitalizations are pretty high. We're not doing case investigations any longer because of the expiration of the ComCare system, but we still monitor through the New York State eClair system.
The 6 deaths, Victoria, did they have other comorbidities?
Many of them,
Yeah.
yes. Like the hospitalized we see do have a lot of comorbidities typically. And we also see that there are some incidental positives. So like people are hospitalized for other things and then positive for
The
COVID.
hospital acquired, yeah.
Yeah.
I see you're still in the green though. in terms of-
Those are polio.
So for
Okay.
community spread, we are in green. That's based on new hospitalization. So some people who are in hospital for a very long time end up testing positive for COVID too. So recently, actually Sunday, the New York State mask mandate expired for articles facilities regulated by Articles 3640. Of which we are one. But unfortunately, our community transmission is still considered high. So we have not changed our policies yet. We still wear masks in our office because we do have that clinic. But we are looking into creating our own policy based on the CDC transmission levels. So,
Some of the people I work with are really, really sick, but negative, but they're sick.
yeah, there's a lot of different things
Yeah.
going
Wow.
on.
There's a really bad cold going around. I had weeks ago.
Horrible.
That's-
Horrible.
Victoria,
Oh, yeah.
on the 6, information where anyone was not vaccinated.
Several were not. I won't say all of them weren't. We do have quite a low uptick on our Ivor booster, unfortunately, which we're talking about ways to, try to remind people that there is a bivalent booster available. But it's been out for
Yeah.
over 6 months now, so.
I've been pushing it because it doesn't, I got the fourth, I got the 2 primary, the 2 boosters, the second booster really did a number on me. So
As
many
far as side
people,
effects?
yes, and so many people had so many side effects, it's like, I'm done.
Yeah.
I'm done, but there was nothing with the bivalent.
Same for
No-
me, actually.
No side
Yeah.
effects with that.
Yeah, for just about every dose, I have a little bit of chills and a low-grade fever, but with the bivalent, I was
Nothing, absolutely
perfectly
nothing.
fine, which is good about that. So I think that you probably have a point there. I think people are.
Just, I'm done, yeah,
Yeah.
yeah.
Is it coming up on camp season? Are counselors at camps required to be vaccinated? On sleepover camps?
Yes, they for most they are, I believe.
Because we had that horrible COVID outbreak.
Yeah.
Well, there's a couple. Everybody's tired now for summer, so like, just thinking about that.
Yeah. So we did do 88 COVID vaccines at our weekly pods, 2 Jynneos and 10 flu in January. Our numbers have gotten, as I mentioned, a little bit lower. So we're looking at reevaluating how we manage those pods going forward. We'll be there on Thursdays through the end of February, from 3 to 5 at AB shop. Or considering bringing that back to our office by appointment all day on Thursdays. Just because it doesn't make sense to send a team out there. We're only getting a handful. And wastewater for COVID, while we're on it, it does seem to be trending down in the Hudson area. That's the only spot where we're doing the wastewater surveillance at the moment. But the performance incentive from New York State Department of Health this year is centered around wastewater. So we're looking at expanding the areas that we do those samplings, and also expanding the frequency because it is supported by the city for us to do that. Very cheap and passive form of surveillance, as you can imagine. Doesn't require a lot of manpower, and you know, it's just wastewater. It's there, so we're for the taking. Yes.
Yeah.
Yeah.
That's right.
Have all you want. There you go.
Yeah.
That's right,
I
that's
got
right.
thousands of gallons you can have.
That's right. All right. We do have a vacancy in our early intervention program. We did receive an emergency fill last month, so we have interviews scheduled at the end of this month. But this is a tough time for that to have that vacancy as we do our annual reviews for children coming up in the next couple of months. But we have a healthy pool of applicants, so we're hopeful that we can fill that as soon as possible. Does anyone have any questions?
I do have, with the masks, what level do we have to, does it have to be at? For they're still in CMH and they're still, what are they gonna do? Do you have any
So-
idea?
The Dear Administrator letter had a very different tone this time than in the past. In the past, it was full of musts and wills and, you know, not as many shoulds. And this time it's all shoulds. So, you know, it's up to the individual facility to make that declaration of what their policy will be. The CDC says that if you're in a high transmission rate, you should mask in your facility, and the state has, you know, echoed that. You know, but we have a clinic 3 hours a week, I think, you know, 2 hours on Wednesday, 1 hour on Wednesdays and 2 hours on Thursdays. So we are going to look at that internally and see what we'll do. Because if it's like, so I think I said it last month, if it's always an emergency, nothing's an emergency, right? So, you know, we have to really.
Because
Take a look
everybody's
at
like, what am I gonna do, Kathy? What am I gonna do? What am I gonna do? You know, because where I work as a nurse.
Right.
Wait for corporate.
Right,
See what they wanna do.
And it's a little bit of personal responsibility too. You know, hopefully that if you wear a mask, people will take the social cue that you're really uncomfortable or having close contact with people that you don't really know that well. Again, it depends on personal responsibility.
Yeah.
So.
Thank you.
Thank you so much.
Any
Thank
questions for
Thank
this
you.
young lady here? Okay, thank you, yeah. All right, they're all signed. All right, next up, Mr. Gibson, Commissioner Gibson, Bob, take that seat there.
It's got 3 identities.
There you go.
So first up, we're revisiting an issue that did get approved and an authorization was granted through a resolution. You might recall around COVID time, we proposed a two-way talk-through window that would obviously help out during any time of a health crisis and make things just easier in general for people who were passing through and just quickly wanted to drop off or pick up. So we'd gone out, we'd gotten our bids, they got accepted. We'd worked that through the committee process to have ARPA funds pay for that. that was all approved. And then the supply chain issues hit, and I kept waiting and asking, someone's going to come down and put the windmill in. That went on for about 17 months. And I thought, well, maybe never. So, I just redirected the staff to get back on that. So unfortunately, we have a commitment to do it again. We put it out to bid, but all materials went up since the last time we did this. So I felt the need to bring this back for a auto resolution because it's a brand new price. The folks are all ready to do it. They have the materials to do it. And upon this committee's blessing, then the full
I'll
board
move it.
voted.
Yeah. It's like $4,000 or something.
Second.
Did we have a FEMA reimbursement previously, or is that new?
No, it was going to be covered under the ARPA. And I understand it's still with it.
All in favor?
Aye.
Any discussion? I'm just gonna move it then. Okay,
Thank you.
you're very welcome.
The second request is to enter into an agreement with Cornell Walker Extension. The opening up their parent education and anger management program. That's just a bonus to us. It's another provider, and it allows us to quite frankly just expand our relationship with the co-op and we look for any opportunity to do that.
Motion?
I'll move it.
Second.
All in favor?
Aye.
So carried.
I put on here, I just want to put on this committee's radar. We look at the burial policy from time to time. It's been about 5 years. The local funeral parlors assist us in helping to bury the deceased who are indigent or when they cannot find next of kin. They also refrigerate if it happened on Friday and they're not able to locate family members. We're just in the process now. We met with the funeral directors several months ago of putting together a fair change to the schedule on fees and also updating the committee's policy. So I'll probably have something put together for the review of everybody at this committee. Well in advance of next month, but we just wanted to put that.
Okay,
Okay.
Thank you.
And then, any questions? I'm certainly here, from my colleague in the youth department takes questions. I'll be here for that. Okay, thanks very much.
you're up next, Mr. Grandinetti. Thank you. You're going home.
Yeah.
Just like being home.
I brought some things for you just to. No, I can share. Good.
Good morning, Kat.
Thank you.
So I just want to go over, I told you last month that Bob and I were going to meet with, commissioners and I were going to meet with OCFS to see what kind of funds were out there. And as we were meeting with them, they kind of went through all the different funding sources and the way the formula they come up with and how it's distributed. And it was pretty clear that there's not going to be much changes. And so what I did is I put together just an idea. Youth bureaus don't appear to be a real priority in terms of funding out of the state. So I kind of just put together, you can see like state bureaus, the entire state make up less than 1%. And then you keep going down, we're like less than 0.5%. So there's not much money coming out, at least into youth bureaus. I'm not suggesting there's not money for youth programs per se. I just don't think it's coming via youth bureaus. I think Commissioner Gibson's, there's money coming through there for a lot of preventive stuff, but there's not much in terms of development stuff. So, I mean, I don't know that there's much of a difference between development and prevention, but I'm working with Bob, Commissioner Gibson, to kind of figure out where we intersect.
Mhm.
And I think what you just mentioned, Cornell Cup Extension,
Mhm.
he was nice enough. I had brought him over and we met with Cornell for a couple hours because they have a really robust program. And when you think of Cornell 4-H, you think of like animals, farm, or something like that, but they do a lot of really good work. So we're going to see if we can't continue to build some alliances with them. But this kind of gives you an idea in terms of funding. The 2023 budget is roughly 25% of what is 25% less than what we received in 22. They're doing it prorated over 9 months. So instead of giving you your full 100% allotment, they took out a quarter. I think it's more of a financial gimmick, whatever helps them, because it doesn't really help us at all. Because it's not like we do it like monthly. We have a year.
Are they looking to see who uses it and move it around? Or
The way I understand it is that because the allocations always come out so late,
Okay.
you know, you run your program, so they're trying to, I guess the program year starts in September now.
January ends in September.
January and ends in September. And the next cycle,
We'll
that
catch
counts
back
for a
up.
full year.
Yes, yeah. So for this year, so our YDP funding, our youth development program funding dropped considerably, like $14,903 from 1 year. And we were going to look for more money and they were actually giving us less money. So that was pretty, not the best phone call. But again, I don't think
Bob
it's,
in the mirror?
again, they were really good to us. OCFS has been a pretty good partner. They're on the same, they love more money too. It's not them that just says how much money you get. So this is really where when I was talking to Chairman Collins, he was talking about meeting with Hinchy and Dee Dee Barrett and trying to figure out if there was a way to kind of, I guess, lobby for additional funds into these bills. And I was talking to Commissioner Gibson about it because I thought that I would reach out too. I just don't know how do we want to do it, because I don't think we want to go there like in different pieces and saying, can you help us? So I thought maybe we just go through Chairman Collins and see where that
Can you hear
lands
me?
in terms of a conversation, instead of me personally reaching out as the director to do it.
Are you asking for funds for specific programs?
Yes.
Okay.
So
He
I guess,
met yesterday. He's got he typed in. You see it at the bottom there?
I know the state.
He had met yesterday.
What's wrong with
I
that?
don't know.
Do you have a,
Who'd you meet
I'm
with?
sure you do, but is there a plan that, you know, we're requesting more funds because we want to do this, and this? Or are we just asking for money because then we will figure out what we want to do with the money?
I think it's and both. I think what I'd like to do is have some discretionary funds that actually work with programs as I see something that's I would some purpose, some outcomes that would be really useful and helpful. But I also think, you know, so the $14,000 that we lost comes out of youth development prevention money. That's what municipalities get allocated out. So the increased money they gave us in youth, sports, and education, municipalities don't qualify for that fund. So this year, when I sent an email out to everyone, a couple of towns kind of the programs didn't get funded because of I've used different towns based on what came through the quids program. So now we want to do a few more towns in 23. Also, we haven't really heard from Greenport yet either, and I know that they have asked for in the past. So I'm just trying to get prepared because I felt a little bit like I left down a couple towns that weren't qualified for 22. So what I'd like to do in 23 is try to give them what they would normally ask for and also make them whole from what they lost in 22. So
But if you go to the state, they have to have something to draw from, and that's a program. So it has to line up with the program that they
Yes.
have that would fund your program.
I'm sorry. When asking, I thought I was asking you from the county.
Well, I got the impression you were going to the state.
Right, as a state, and I think,
I mean, as far as the
Right.
county goes, that would be during the budget time with a plan, which would be next summer, basically. When you come to the county and say, hey, we'd like to do X, Y, and Z for youth, and this program we'd like to do goes through many, many meetings, and then, you know, the
Sure.
county would decide if in fact we could allocate more funds, but I don't know, you're talking about the
okay,
state.
and I apologize, I think I.
You said a wandering phone in or something.
Yeah. That's so, but we can talk about both, because I think we're trying to do both. I think the idea of lobbying for additional funds, I mean, some of these programs that we're funding are like barely getting by. Like this morning I was out in Chatham,
Brandon?
Trump Memorial,
Yeah.
Morris Memorial,
Memorial.
and, you know, it's a healthy program, but I mean, it's like, it's got like a pool table with like 3 legs, and, you know, I mean, there's just not funds that really.
Well, they have their own,
Right.
pretty hefty fund drive that they run on as well as Crown does.
Yeah, well, they lost, a good funding source out of their town, the town.
Village.
So, but anyway, I think I'm sorry.
Are you doing something?
No, I thought.
I heard something.
I thought he was trying to.
The
Janelle, did
village-
you say something?
Yeah, the village had given them a stipend and they cut it off during COVID.
Anyway, I mean, it's a robust program, a really good guy out there that runs it. And it's just, if we could do more, they could actually use more. So I think you're right, Laura. The idea of, I mean, if you look at the amount of funding that is generated to youth bureaus, it's so paltry that it's almost like an afterthought. And maybe speaking of like what we're looking to do and support our not-for-profits and our municipality summer programs. Maybe they need more than, it's more specific than that, but I think that argument should be enough to say, let's look at this amount of money that we're giving. Now, with that said, the other concept that was coming to the board, Matt, in the board in terms of in the summer. But I also was wondering if you folks would be interested in making up the $14,000 in terms of this year that we didn't anticipate losing. That's, I don't have a resolution for it, but that's what I was wondering if you guys would entertain.
We'd have to look at available funding. I can tell you that, you know, our budget was, that we passed was pretty tight. There wasn't a lot of wiggle room.
Okay, just,
But it's a good time to go after state legislators. They're developing a budget, and so it's a good time to sit down and talk to, you know, try and advocate for some of this stuff.
Well, especially if we get identified the towns that were left behind, that have been previously funded, but were not funded because of fewer funds. Wouldn't there already be program dollars assigned to those programs, or were there programs outside? Were they something new and different? Why did they not get funded this year?
because 21, they didn't have, so what happened is some of the programs didn't run because of COVID,
Right.
but they ran previously. And what I did is kind of went back to the programs that I could identify immediately because it was kind of time sensitive. So some of the ones that, again, even though they didn't do in 21, they did it in 19. And so I wasn't able to.
Wouldn't the reason to go back be to reinstate existing programs?
Yeah.
Is that-
Oh, yeah.
Right.
I mean, what I'm gonna try to do is get them into the funding this year. But with $14,000 less money, I mean, that's a 25%.
If I could, in 22, which is what this funding was for, right? 22 or 21.
22 are all set. 23, they just released.
But what year did they go to short for the 2 towns? 20 for 21?
22
22.
this year. Because of my, calculations.
So what happened was in 20, in 21, they didn't run the program, but in 22, they did run it. is the way I understand it.
Somehow, there's a quiz program that you go in and you look for the towns, and some were in 21, but they weren't in, some were not in 21 that were in 20 and 19. And I think it just came down to the COVID.
Well, some towns just, they did do programs, so they didn't necessarily want to, because.
Yeah, we didn't do a program. I mean, what, how much, of the 14, how much did the towns specifically not get?
2 counts,
How much money?
6,000. I think it was again and Livingston, but again, Greenport as well. So there's a few other towns out there that, as I went through quiz, have participated in this program, but not last year per se.
So have you
But the money
talked to
that-
any of these towns, do you know that if those funds were available, they would be interested and able to provide those programs?
Absolutely. Yeah, I think they were
That's the
disappointed.
argument.
That's gotta be
I
the
think they
money
were
that I
disappointed
donated
that.
to Operation Unite,
that
right?
It didn't work out.
See, the town of Greenport has always donated the money to Operation Unite. We've never taken the money specifically. We donated it back and gave it to Operation Unite. Okay, that's what we always did, because it wasn't a,
Okay,
yeah.
so Greenport didn't take their share and instead they moved it, okay.
We
That
donated
must
it.
have been sort of like in flying, I don't.
Okay.
And then the other, so that's 6,000, where's the other, 8,000 actually? Because you're asking for 14, so.
Right, that's, so, yeah, so if you look at it, last year they gave us 59,614 for YMP. This year it's 44,711. So I had to cut 25% from folks and then add the other 2 towns as well. So,
Is this a reimbursement program?
So we're back to getting the 60 to
That's-
43 now?
that's- Got it.
yeah,
So for 23, are we back to the 60?
Financial meeting.
yes, that's what they said.
Can we move this like to a financial?
Yeah, that's really
Yeah.
a finance.
Yeah. Can we move this to?
Yeah, I guess
think
I was
we
just trying to check the temperature of the, because going forward, I wanted to highlight this for you too, this process then. Because now that the 23 funds are being released,
Mhm.
this will give me an indication, am I cutting 25%? Am I, there's $14,000 to kind of maneuver around. I mean, I'll have to do it if that's the outcome. But if you are inclined to say, let's look at it and maybe we can find 14,000, it would change my conversations with the providers.
So I'm confused again, I'm sorry. 60,000 we get in 2023, right? So we're not
Yes.
short in 2023.
Right. Well, the new programs that
there's
people are developing now.
There's 2 different funding sources.
Yeah.
So this year we only get 44,000 YDP funding.
Yeah.
And that goes to municipalities and some not-for-profits.
That's 16,000 short, of the 60.
Yeah. So the youth sports and education funding, we're working with Got Game Sports, Cornell Corporate Extension, and Greater Promise, Hudson Promise Neighborhood. Those are the 3 folks that qualified for that fund. So that is kind of separate and distinct from the YDP funding. So, and they didn't get any money out of the YDP fund, those folks. So that's where again, I actually put a blueprint together to show I could do it if we don't want to entertain adding an additional 14,000. But people would take 25% cuts. And I let them know already that's a possibility. So it's not like I haven't informed them. I just wanted to check the temperature here going forward, because what's been going on is, like, right now we're in 23 paying 22 bills. What I'd like to be able to do simultaneously is pay 22 bills in 23 and start 23 bills and have them done before 24 comes. So that's why I want to kind of move this along. So before April, you just gave me approval to go into contract for 22. I'm going to ask for approval to go into contract for 23 in like 8 more weeks. So I want to kind of catch up. So
Need a
that
resolution
conversation, that's why I'm
Need a
kind of bringing it up.
resolution for that?
Yeah,
How
he'll
about
come
the
back for
services
that.
for 2022 are we been delivered?
Yes.
The state has been painfully slow,
Well,
Well, yeah.
even giving out the allocations.
Okay.
So it's, that's why they
If you
went to
decide
this
to,
abbreviated
instead of
schedule
running forward,
to try to catch up and put
you
it on.
donated it. You had to donate it.
It's allowing us to time to catch up too, so all of our summer programs will know exactly what they're getting before the program starts. September, they can put in the claims and everything will be done before the end of the year.
Mhm.
So,
So the 2022 money will pay for 2023 programs?
It'll reimburse their 2022 budget.
That's for the gap, that's the gap. For me.
Yeah.
Because if the budget's already been spent, if we've already spent it, then
well, we're signing contracts in 23 that happened in 22. It's just when.
Behind.
It's because of the state's, time.
Yeah, I mean, part of the problem, the state is, a slave to, DOB, and DOB has no concern about timing.
But
Yeah, what the county gives is what the county gives, but if the county's reimbursing for what the state is not giving for specific towns, I don't see how the county would put that money up. I mean, I'm not saying the county wouldn't put more money up in the next budget, but I don't see how the county could say we gotta make up for the shortfall for two towns.
well, I'm adding the 2 towns. I don't want to say the 2 towns are a shortfall. They would just be part of a smaller pot.
Right.
So,
I think it has to come from finance.
Well, we need to talk to our finance people too and see what
So I'm just looking for some direction, that's all.
I would not, at this point, and I'm not saying it won't happen, but I wouldn't count on it in this one.
That's right. It helps me.
Mhm.
And so the other thing I gave you is this kind of give you an idea, like what's our responsibility, what's the not-for-profits and municipality responsibilities, and what's the state's responsibility. So you can see, in terms of the allocations, the approval, and we just got approval for the reallocation, process. So we brought that down today to get Matt to sign it sometime soon. Oh, you did? Okay. So that kind of starts the whole ball roll. And then so kind of from January to April, we want to have all this done, all the way down to contracts. And then monitor the program, and then approve and pay claims should be happening in September to December. So that's the goal of trying to, with the state catching up, we can catch up and everything will happen in the year it's supposed to happen. So that's kind of discussion. I apologize, but it helps me now going forward.
Trying to get money out of the state is a challenge, no matter what the partner is.
And I'm gonna meet with you, don't you even worry, county report's gonna be calling you, don't you worry.
And so my was.
Up
It's
there,
up on the screen if you need it.
up on the board.
Yeah, so this is what happened last month when Matt said, I didn't know we needed approval, but I have a youth advisory board, that needs approval from you folks to create it.
Mhm.
And, it's part of
Mhm.
the
Oh,
requirements
that's
from OCFS. We got a pretty good list of folks
Yes, you do.
and,
I'll move it.
Second?
All in favor?
Aye.
Any discussion?
Came from,
You can hear it
Yeah,
all.
there you go.
I didn't have the
What
volume
happened?
turned up, poor
I'm
guy.
so carried.
Do you have any state members?
I'm actually working with Cornell Park Extension. They have like a leadership program,
Or the
something
4-H program?
that they're gonna send it to you, and that's part of, with them, yeah. And I did check with, a couple, the co-hosts, the group, I'm trying to get them to see if they have, a couple meetings that they would like to provide. But- So I apologize, I just spent a lot of your time talking about my department stuff. when I-
all right, you're educating us, that's your job.
But yeah, you're fine.
and we get your feet on the ground.
Yes, I'm feeling pretty good.
Just a quick question, the vouchering, Bob and Dan, in reference to the busing program, if you want that out there.
So.
I'm sorry, the question, we had talked about reimbursements to the towns for busing, and I submitted a bill just to see where we're going. That'll be it now, but I'm just curious what the plan.
Well, this is how that's going to work. So I'm going to, much like I do in summer programs in Hudson here, I want to offer that opportunity to any summer camps for all of them. Having a little bit of trail. This is where I think in the future of an increased budget and youth department would be good. We could spend, you know, some other job on that, if we could pick this up, $100 on the dollar. But I can fit this into the
Okay.
pension budget.
All right.
And that's how we're doing it. So we're working through one of our, pension loans. This will sort of be a pass through.
Great.
So I'm just looking for towns to get into transportation. needs.
I think that needs to get out to the supervisors.
Absolutely. And I think we've got it.
And-
We'll do that again. And that would be-
Okay, great, thank you.
I'll send out another email just because the last email was a little bit confusing because we added bus and transportation with the cost for kids that couldn't pay
Right.
for. And that,
I think a simple email, it just says that, the county will
and
just send us your vouchers, for busing.
And the reason was that
You'll
the
get reimbursed.
commissioner found out that we can't be proactive and have you set the tape. The request has to come in first, and then we can set the other to refund. So, but,
So those towns that didn't get the money will get their bus reimbursed, that will help offset what they didn't get from the state.
Yeah, so it's essentially the towns can then go about the business of arranging transportation and pass the cost over. I'm looking for a rough estimate of what they think that should be. So I can say,
Have you gotten any others other than mine?
no, yours wasn't first. And I think, the other important point, Director is trying to make is, there still may be families out there that can't afford, if there are summer, camp programs that do charge, and families come forward and can't pay, that, just pass that information on to us, is that we can send out to your clerk an application.
Okay,
It just can't be done in advance.
thank you.
I'll send out an email tomorrow.
Great, thank you.
Thank you, Danny. I'll be talking to you. I'm just using that last minute, right on the wire. Thanks for your help there. And last but not least, it's Dan Almas,
Good afternoon, everybody.
live and in person.
Right.
Good sweater.
I know.
Valentine's Day.
Everybody.
I wore my red cowboy boots.
Right, happy spirit. So good afternoon, everybody. Just 3 resolutions, today, first of which is a financial resolution. This has to do with, our desire to roll over, funds related to the OMH workforce dollars that were allocated to, our 31s. Some of the monies, it was a total of $60,000, you may remember, some of the monies are being spent in 2023. So we worked with, Jim Breed's office to make that move. So I ask for your support in moving the remainder of the money over to 2023 budget.
I'll make it, I'll second.
All in favor?
Aye.
Any
Aye.
questions, problems, concerns? Voice from the heavens.
Right.
We're gonna move it. Thank you. Carry it. Thank you.
Thank you. Next resolution is just a desire to renew a contract with a recruiting agency known as Locum Tenens. This is an effort to just have it up to date so that when we have a need, we can act promptly.
I'll move that.
Subscribers.
Second.
All in favor?
Aye.
So carried.
And then lastly, I'd like to contract with a peer-led organization known as People USA that is based in Dutchess County. This would be to contract for a certified peer specialist in the mental health world. This is an individual with experience. We had a peer specialist in our clinic previously. That person went on to the multidisciplinary field response team. So we've had a vacancy for a while. Prior to this, we got peers through the Mental Health Association of Columbia and Greene counties. They've been running advertising for us for several months. It hasn't yielded anything. Spoke to the executive director of People USA. He's assured me that he would be able to identify a peer that could do the job in a suitable fashion. So I ask for your support to contract with them for a peer specialist.
Is this age related or is this all age groups in terms of ages specialists?
They would serve all of the ages that we serve in the Article 31 clinic. So it would be school age up through the age of population. You may remember we used this person as peer as a really vital part of our open access walk-in model, which when I get to my report, I can talk about a little bit, but we're on the cusp of relaunching that. I'm very excited about that. We're going to be doing it in a soft sort of way, soft opening, 1 or 2 days, not the 4 days that we previously did. But the peer specialists with their lived experience is in a very unique position to talk to individuals that are seeking services at the clinic, reassure them of their decision to come and seek help at that moment in time, and so on and so forth. So they'll be interacting with the children, the families of the children, and the adults that seek services.
I'll move it.
I'll second.
All in favor?
Uh,
And so carried.
The suicide rates for teenagers in New Orleans came out this week and they were just astonishing.
Very high. Unfortunately, that's getting a lot of publicity because of what happened in the school with that young 13 or 14-year-old student that committed suicide, died by suicide, I should say. But yes,
13% for teenage girls and 6% for boys.
Nation.
so I won't be speaking specifically about that, but I do have some news in terms of our substance use disorder prevention programming here in Columbia County when I get to my report. It's optimistic. But let me finish out the overtime report if I may. So we start out with $12,000. We barely scratched the surface at $657.48, leaving us with amounts of $11,000. $11,332.52.
Yeah, I have a question. In regards to the suicide rate, and we just talked about schools, maybe you know this answer, maybe you don't. This, and I know for a fact, because I'm in some of the schools locally, is that coming down from the state, where the kids that are just unruly and are out of control and are left in the schools? Is the state telling the school districts, we don't want these kids expelled, we don't want them out of the schools? Or is it the individual schools that are making that determination?
I don't know. To be totally honest, I don't know. Of note, I've been invited to I believe it's a monthly or maybe a quarterly, do you know? Monthly? The monthly meeting that the health department has been having with the superintendents. Greg Hansen from Quest Archery Boses has invited me because they want to make a shift, now that things have quieted down, hopefully with COVID and the end of the public health emergency. They want to focus more on behavioral health. So I'll be meeting with them on a regular basis and maybe I can answer for you there.
That would be really helpful. I'm just curious as to why.
But I don't know
it's gotten
the nuances.
somewhat out of control, and there's less, reprimanding and or controlling of some kids that do this repetitively and are left in the school district. I'm just curious. Thank you.
That's a good question. So we have my director's report in front of you. I'll go over a few highlights and start with the public health emergency. What's not on here is the mask mandate as it pertains to the Article 31 clinic. I was informed first thing Monday morning by several of my staff. We were excited because they thought the mask mandate ended. I've since reached out to my regulatory agency, which is the New York State Office of Mental Health. They're working on guidance. Once they've completed the guidance, they'll let me know. I suspect it'll take the form of something like, they'll defer to the licensed entity, in this case, the Article 31 clinic, to make a determination as to how the masks should be used or not used within the licensed clinic. My plan, if that's how it shakes out, will be to allow those that don't want to wear the mask to go without the mask. Anyone feeling as if they need to wear the mask for their own comfort and reassurance, wear the mask. As it stands now, we don't wear the mask in our offices when we're by ourselves, but if we're walking in the hallways, the restrooms, the waiting area, or meeting as a group, we wear the masks. And when we meet clients, of course. I want to bring to your attention a couple of things that, as a result of the sunsetting of the public health emergency, will take an effect on behavioral health providers as well as us, of course. So one is the Ryan Haight Act. This is interesting because the requirement for a person to be seen face to face when controlled substances are being prescribed was, temporarily waived. It's being reactivated. This will be challenging for us because throughout the pandemic, We have some on-site prescribers, and we also have one 100% remote prescriber. That's through that entity known as Novotel. The prescriber works and lives in Texas. So it would be a challenge. We would have to create a mechanism to track this. We'll have to ask our on-site prescribers to see the patient on behalf of the nurse practitioner that's fully remote, in the instance when she may be inclined to prescribe a controlled substance. Now, our prescribers are very conservative when it comes to prescribing controlled substances, but on occasion they are indicated and prescribed appropriately, of course. So it's just a bit of a snafu. It's a bigger headache for providers whose prescribers are all remote. I don't know what they're going to do because they have no fallback to an on-site prescriber. So it's a challenge. The other challenge that's bulleted there is the platforms that we've been using. We at the clinic and at the Department of Human Services have been relying on Google Meets. We were assured that it was a HIPAA compliant platform. I'm at a loss as to why it's suddenly being categorized as a non-HIPAA compliant platform. I don't know if that's because we're using the free version versus the paid version. Maybe there's some nuance there. I've asked Michael Lehman, who's our embedded MIS employee, to look into that for me. Worst case scenario, we'll have to use another platform, which will likely come at a cost. Platforms such as DoxyMe and things like that are what prescribers and clinicians have used, but that comes at a cost. And there'll be a lift in terms of staff having to learn a new platform and also patients, our clients needing to learn a new platform. Next thing is the sequential intercept mapping, which is the wellness hub. I just want to update you on that. The biggest thing there is that things are moving along slowly, as I understand it. The land that was donated was deemed appropriate to build on, which was a big win. But the OASIS, the New York State Office of Alcohol and Substance Services, has since rescinded the funding for the capital project to build the detoxification, the regional detoxification center. There's a lot of desire to advocate and encourage the state to reconsider that. However, the group that's been involved in the Wellness Hub is just entertaining alternate ideas. The regional detox center would have been a good thing for Columbia County, but remember, it's regional, so it would have been serving 6 or 7 other counties. There's no guarantee that our people would have been guaranteed a bed. The other thing is, in response to the significant opioid overdose rate and death rate, detoxes aren't the ideal place. Folks in this day and age aren't often being sent to inpatient detoxification centers when it comes to an opioid detoxification. It's people that are being detoxed from alcohol and from a classification of drugs known as benzodiazepines. Alcohol and benzodiazepines, your organs will shut down, you'll have seizures, and you may die if you're not medically supervised. Chairman Ladoni, okay?
I don't know.
Should we check on it?
My health and wellness.
You might have to-
So, we're looking at alternatives is all we're trying to say. We may call upon our county leaders and state politicians to advocate on our behalf for that regional detox to be reconsidered. But,
Was the program, i.e. the size of the building changed if it were not regional, if it just said Columbia County?
I don't know if we would necessarily push for an inpatient detoxification center just for Columbia County residents. The reason being is the volume isn't there at any given moment.
Right.
It's a significant need. Let's not forget, in 2021, Columbia County had 15 individuals die from overdose deaths, opioid related overdose deaths. There were hundreds of overdoses, but only 15 deaths. Our neighbors in Greene County, unfortunately, had a much higher rate of 25 individuals died from overdoses. In terms of other announcements, Judge Cheryl Roberts has taken off with her mental health treatment court. That's a real asset to have. That's served at this point Hudson residents only, but I understand this may be a little premature, but there is hope that the towns and villages will be able to funnel their cases, if appropriate, indicated to this court as well. The MDT multidisciplinary field support team seems to be doing well. I'm working with them around creating metrics to gather data. I believe they're close to their first year of the 2-year pilot that the county has supported. So we'll be talking about how to justify, their existence going beyond the 2 years. Medication-assisted treatment, that's methadone, Suboxone, and Vivitrol to address opioid use disorder in the jail is being handled by Prime Care. I've had a meeting with Prime Care representatives just to understand the parameters of the work that they're going to do versus individuals like my forensic coordinator through the Department of Human Services. I believe wholeheartedly there's enough work to go around, so we're just going to figure it out and divide the pie, so to speak. Opioid settlement funds, we're continuing to work as a work group in terms of bringing recommendations to this home committee and county leaders as to how those dollars should be used. We have plans to offer a total of 4 community forums over a period in April into May. We're trying to put the final details on that. We're not going to lead in those community forums with, hey, everybody, we have $2.2 million available. How do you think we should spend it? Instead, we're really just going to be asking the community what they feel the needs are, where they feel the gaps are in services, take that information, process it, bring it back, and then the smaller group will make a determination and decide about how we can use the 2.2 million that will be trickling in over a very long period of time. Now, with that being said, I was just notified yesterday from the New York State Office of Alcoholism and Substance Use Services that Columbia County Local Governmental Unit, the LGU, which is what I head up as the Director of Community Services, is being awarded an additional $280,000 from the state settlement. So I've been asked as the LGU to come up with a plan as to how we're going to allocate those dollars as well. So it's a nice problem to have, is how I would characterize it. Next on the report is, I just want to make everybody aware that the Columbia Green Addiction Coalition, or CGAC for short, that's been in existence, if you're not aware of it or familiar with it, for about 10 years or so. It was initially formed to respond to the opioid epidemic that was really in full force back then, and still is, as well as helping entities like Columbia Memorial Health address how they, their prescribing habits in terms of how they dispense controlled substances, either in medication of opioids or controlled substances like benzodiazepines and stimulants, like Ritalin and Ativan and so on and so forth. At that time, basically, there were 2 camps, either a super conservative camp where a prescriber was afraid to even write a prescription for a controlled substance because of the ramifications or the likelihood that it might be diverted by the individual and sold for profit. And then there were prescribers that were super generous and contributing to the problem of diversion. So we worked with the hospital at that time. Tremendous amount of work has occurred over the past decade. What's going on most recently is we want to move it from a coalition to a nonprofit. The reason for that is a coalition isn't eligible to go after grants and funding opportunities. A nonprofit is. So we have some money through the Healing Communities program that is winding down. We were able to hire a program director, Anna Calhoun. She's taking on the task of organizing the coalition into a nonprofit, is doing an amazing job at that. She's also trying to secure a grant. Hopefully the timing is right. Hopefully we will be a nonprofit in time to submit our application for this grant and then be able to do work via the grant. The next item has to do with Columbia County Substance Abuse Prevention Services. I believe the last time I reported on this, I shared with you that Catholic Charities had rescinded their desire to be the provider. They had been doing it for several decades, actually. in Columbia County. So they came to me, informed me of this. The state had a particular idea of how we should proceed. I disagreed. Thankfully, they softened and are allowing me to go the traditional route of formulating an RFP, getting the applicants or the proposals from community providers, picking a provider. The stage that we're at now is that we have pretty much put together a final draft of the RFP. We're sending it to Oasis for them to look over, and then we'll be sending it to, I believe it's the county purchasing department that issues the RFPs. Do I have that right?
Yep.
So it'll be in the hands of the county purchasing department, and they'll be pushing out the RFP. I did a summary of, some of the highlights from Governor Hochul's State of the State. Basically, if you had a chance to look at it, I assume you had, she's proposing that a lot of money go towards behavioral health. There's a housing component there. There's an element of opening up, reopening a lot of mental health type beds that were not able to be staffed in the state facilities and so on and so forth. I think one of the next or last items as far as Director of Community Services has to do with the what's known as the DEA data waiver. This has to do with prescribing buprenorphine or Suboxone. Prescribers used to have to take a course. There were limitations in terms of how many people they could serve in the beginning. All of that has gone away, and any prescriber is eligible to prescribe buprenorphine or Suboxone at this point. So that is hopefully going to open up the pool of physicians that will be offering that medication to individuals that need it. In terms of the Department of Human Services / Mental Health Center, my department, we're still operating at a lower admitted total number of cases and admitted cases than we ever had. But please keep in mind that we are short-staffed still, very much so. So there is some progress in that we've onboarded a new social worker as of a few weeks ago. We have a gentleman starting on the 27th. I'm doing interviews as fast as I can. I'm grateful for the fact that we're getting resumes. However, the resignations continue. And retirements. Our dual recovery coordinator, which is a position that is partially grant funded through the state, but the county does subsidize that position as well, opted to retire. So I'll be seeking a replacement for that position. We had a behavioral health social worker or a clinical position resign. So I'll be looking to fill that position. I'll bring the resolution for the backfill next month. So it's still a struggle, to be honest. I'm still looking for a clinic director. We've done a few interviews. I'm working with the team. The candidates, some I feel could do the job, but they haven't wowed us, is the best way I can put it. And maybe looking to be wowed at this point is asking too much. I don't know, but I don't want to settle either. It's a very important position. Having done the job, I know how important it is. So I'm really looking for the right person, as is the team that's involved in the interviews. What else? I mentioned the open access walk-in clinic. We were hoping to go live with that on March 6th, but with that latest resignation of the social work position, I kind of put a little delay in it because we have to absorb that individual's caseload, who happened to also absorb the caseload of the previous person that resigned. So the amount of shuffling of the clients is very concerning to me. It's taking a toll on the folks that we're serving, because in some cases they've been shuffled around as many as 3 or 4 times to 3 or 4 new therapists. So I'm very concerned about that, but the clients understand that it's nobody's fault. It's just not ideal. And then lastly, the Department of Health grant that we've been participating in with our children's care coordinator, who's been going to the 5 districts that have opted to welcome him at, to address needs of the students who have either tested positive for COVID historically or who have COVID currently. That worker is Eric Swift, and the feedback that I'm getting from the superintendents is that they're extremely happy. That grant unless extended, I understand will be ending in July of this year. So I did drop a hint to the superintendents that I would be more than happy to work with them if they're inclined to figure out a way to cover the costs of that employee so that he could continue to be there 1 day a week, 7 hours. I'm happy to entertain questions or comments.
Are we still maintaining office space in BMA up there, or?
No, Supervisor, not, that has since ended.
I was there the other day and the sign in the hallway still said our names. I didn't know if we were still in there, but I
I'll
thought
leave
we
that
were
to the
getting out of there, so that's why. I asked.
Yeah.
But no, that ended.
Yeah, I thought it did. But they don't know that.
Quick question about the telemedicine platform. When would you need to know, or have the status confirmed, or in order to provide uninterrupted services in the event that we need to provide a new platform?
Sooner than later, because, yeah, well, May 11th, I believe, is when the public health emergency ends, so come May 12th, I need to be in compliance with a HIPAA compliant platform, so MIS is on the job, they've never let me down. I expect they'll at least give me the information as to whether we need to pay for Google Meets, but we're getting access to that in a free sort of way at the moment. And if we need to pay for it, so be it.
But don't we have multiple licenses through the county? So that we,
We belong to Google Suites, which is a whole business platform, and along with that comes Google Meets. So
Right.
I'm
So,
not sure what their
I'm
criteria.
just guessing when I say that maybe it's
Would have to
because
be
we're getting
Google
the free
Medical.
version versus
Yeah,
the paid
exactly.
version.
It'll be a Google Medical Meet.
Yeah, there's probably different.
We have to pay.
Well,
for
my-
COVID's.
My goal is to have no disruption. There cannot be disruption for multiple reasons, revenue, collection, client services, and so on. So, we're on it. I just first need to understand how it went from me being told, Dan, you're solid. It's HIPAA compliant to suddenly learning it's not. How does something go from being HIPAA compliant to not being HIPAA compliant? It's the same exact thing.
Yeah.
I wasn't expecting.
Yeah, someone's looking for more money.
That's exactly what it is.
Yep.
We're gonna, listen, they're using, it's a lot, it's going to be Google Medical.
Yeah,
Meet.
Yeah. We gotta wrap this up.
Any other
Safety.
questions?
Thank you.
Thank you very much.
Any questions from the public for anything? Okay, I need a motion.
I'll
to
entertain a
adjourn.
motion or a motion.
All in favor?
Aye.
Bye, everybody. Happy Valentine's Day.
Okay, I'd like to call the February Public Safety Committee meeting to order, please. First one up is probation.
Hey, everyone.
How are you, Vince?
All I have for this month is submission of the 2022 report. And basically, I give it to you this month and we look at it for a month. And next month, I can answer any questions and.
Thank you.
Any questions?
Sound good?
It's
Abusing.
Public defender, not here, huh?
Right.
That was also in the report, so if there's any questions, please let me know for next month. Sheriff?
We'll just walk it in and just go more.
All right, we're skipping. 911?
Evening.
Good evening.
I have two resolutions for you tonight. Both are to basically move grants that have been previously approved and move them to the 2023 budget. So the first one is to request authorization to extend the budget for the following grants that are listed there to match the period of performance for the grant, and all grants to be dispersed in accordance with state homeland security and emergency service guidance.
Move it. Second. All in favor?
Aye.
Opposed? So carried.
The second resolution is the same, but for 911 grants, for the same, just one that has to be moved. I moved one last month as well.
Move it.
Second.
All in favor?
Aye.
Opposed? So carried.
I also have submitted the 2022 budget for your review. And the only other thing I have is agency data for January 2023. Our call volume incoming was 3,953 calls. We dispatched and notified 1,307 EMS agencies in January, 331 fire agencies, 1,760 police polls, and 393 public service calls. That's all. I have.
Rob, do we have any, update on the cell service? I know we had talked, I know.
No,
we've been working on
AT&T
it.
ended up switching to push some more coverage on that 66 corridor. Verizon is looking at it, but they wouldn't tell me what they were gonna do.
Okay,
So that's the only report I have.
thank you. Any questions? Thank you. Sheriff? How are you?
Very well, thank you. How's everybody doing?
Good, thank you.
Happy Valentine's Day.
Yes, sir. You too.
So we have a personnel resolution request to fill a vacancy created by a disability retirement. One deputy sheriff's position, 52,693.
Move it.
Second.
All in favor?
Aye.
Opposed? So carried.
Next will be authorization of the sheriff to enter into agreement with Questar. This is for a Stop the Violence grant that Questar is heading up. It's just a law enforcement liaison partnership.
Tell more about the program.
Sure. So Stop It App is an application that can be downloaded onto your cellular device or iPad. Each school has an individual code, so you have to opt into that code. Questar is the leading agency, so everything will be going through them. We worked for several months to get a lot of the answers that we're looking for. So it's just not a cookie cutter type program. Some of the other sheriff's offices throughout the state are doing this as well. We took a little bit more of a proactive or a preactive stance on this, where we're going to receive a lot more of the calls than some of the other sheriff's offices are. So, for example, there's 3 levels of we'll call it the concerns, immediate threat, mid-level, and then like your running the mill. You know, I didn't like to watch yesterday. Put it to play. So we're going to get the top 2 levels. We're working with each school district to ensure that. But we need to sign the grant before we go any further with it. So basically, you can text in any concerns that you have, the bullying, you know, so could be run the school, and they'll automatically go to the call center. That call center will send that information in.
So, like a bunch of different staff in the different schools will have access to the reporting?
It's going to be determined by each individual district. Every district within Columbia County other than Germantown is going with this application. So, you know, it's determined by the school, and we'll be making sure that we, you know, how we're saying it, and so the sheriff's office feels a lot of these calls. You know, I just felt that it's important that we took a little bit more of an aggressive approach, because it's not only school issues, it turns into an issue in the community.
Yeah.
So we want to be well aware of anything that's going on to this application.
And so who runs the app?
It's a private corporation, private entity that has the Stop It App itself. So the application is going to be custom to each school district, like I said before, depending on what they want their thresholds to be.
And then the app, so they contact the app, and the app contacts your department, so that you can
Correct.
have that data to respond to.
It'll be a call center that receives the text message, and then you know, they'll rate it in their, you know, depending on which range it falls into, and that contact will be you know, by predetermined choices that the school district makes.
And then this is through a DOJ app, grant? You know, justice assistance.
That's correct.
And then is it specifically for this app, the grant, or it's the grant is for doing school violence, and you're choosing this app as this?
I'm not choosing, this is Questar's app.
Okay.
They just need a law enforcement liaison to sign on to this application. Everything is done through Questar and Craig Hansen. Again, we've worked diligently with First Sergeant Pete Greskow and Deputy Mike Regan, along with Craig Hansen and his staff, in order to make sure this is a good fit for Columbia County.
Okay, thanks.
Sheriff, you said village school, but. Yeah, Germantown is going with a different application and, off the top of my head, I'm not sure what the application is. They found it to be a better fit for their school business. I'm not sure why. Like I said, First Sergeant Pete Brescow, who's in charge of our school resource deputies, we had a conversation with the superintendent out there, and you know, they decided to go a different direction.
Homework. Okay. Thank you. Thank you.
You're welcome.
Any other questions? Motion?
No.
Second? All in favor?
Aye.
Opposed? So carried.
Mike, I can get you whatever information you need.
No, that's great. It's didn't anything for less, but not good.
The only other thing I have is just some data, out of county inmate report, for January 2023, Green County, $17,100 in revenue we took in from Green County. U.S. Marshals was $8,370. Total for January, $25,470. Year to date, $25,470. The year to date previous was $29,790 this time.
Question, how come we're taking anything into Green County since we got the new jail?
Yeah.
What it is?
Yeah, I mean, we still have a linear style jail, which allows us to you know, house differently. And they're dealing with resource issues as far as staffing as well, so.
I didn't hear the reason. Why?
Our jail's a linear style jail. They have a pod style jail. I think supervisor, you're at the jail, see how it goes around kind of a square.
Yeah.
They have pods. So if they have a large population of male inmates, they don't have room for female inmates, or if they have to have something shut down based on COVID, a situation where there's no housing for the female population, we can separate the female population more easily than a pod style jail. And also the resources as far as staffing is down. So,
And what's the population there in the jail?
our population? Yeah, but 52 or 55. Undersheriff says 52.
That's the most we've had in like at least a year and a half.
We had, we were over 60 about a week and a half ago.
I mean,
Yeah,
these numbers prior to that.
Correct, Sheriff, 55.
55.
And what's the
That's what I have.
percentage of out of county? Or what's the number of out of county?
I think it's still holding at 9, but I'll have to look. Let's see, 1, 2, 3. 2, 3, 4, 6, 7, 8, 9, 10. That's including parole. So 8 out of county and 2 parolees.
Mhm. Okay.
I have the numbers for last year too, if you want to see it, supervisor, but I can get that to you another day if you want.
Okay,
Last
thank
year's one.
Where did we end last year with, as far as revenue from the jail? Do you have that one?
Revenue, I do not believe so. I have total count of incarcerated for the year. I can get you the financial report as well. Total count for last year was 263, 205 being males, 58 being females. It's broken down in ethnicity, age groups, and race as well.
Do you think, Sheriff, that inmate population might go up in the future if they change the law at all or anything, or just?
I think it's going to go up in the future regardless. The courts are now open. We're going to be seeing more sentenced through town courts as well as county courts. County is, I want to talk about the issues with the county court scene in those sessions, but we have a huge pile up right now of cases. We're not getting, this is not fact, this is what I'm hearing. We're probably going to have at least 2 or 3 cases on a docket a month for trial. So a lot of those folks are going to be housed in the facility awaiting their sentencing. And then legislation, if there's bail reform gets changed, we'll see some change in that as well. As well as, the gun laws coming up, so we'll see some residual effects on those also.
Any other questions for the sheriff? Thank you.
Thank you.
Thanks, Jeff.
Have a great night.
Anything else?
Oh, you did?
Oh, terrific. Oh, yeah.
Good. Bueller?
That's good. Just putting my other hat on, the revenue last year for the jail, if I recall, was somewhere around that year. So,
Thank you.
not much. I remember once upon a
I
time.
remember it was 500,000-600,000.
Yeah, we thought we were gonna hit a million. Anyway, those days are gone. First of all, upon the recommendation of Rob Fitzsimmons, we need to amend resolution number 308-22. That should state, whereas the county has contracted with Fitch and Associates to analyze, make recommendations to sustain our Columbia County EMS system for the future. On recommendation of the county attorney, amend resolution 308-22 to recognize this vendor as a sole source in professional services and exempt it from procurement requirements.
That's what we talked about.
Yeah.
I'll move second, move second. All
Opposed? Okay.
Second resolution, myself and my deputy is we have portable radios that are over 15 years old, and quite frankly, we can't communicate with anybody, let alone with a mass casualty incident. Should have been replaced probably about 3 or 4 years ago. Total cost of these is $11,365.55 on state contract. I brought that to the ARPA committee a couple weeks ago. The ARPA committee approved it. But since Rob Lopez has found me some grant money, which we won't have to touch the ARPA funds. Is that correct, Rob?
Yeah.
Yay.
So,
Good. Great.
Second.
All in favor?
Aye.
Opposed? Okay.
okay, just an update on the Fitch program. The Fitch has extracted all the data from 911 for EMS. However, they're waiting to extract the data for fire service from 911 as well, because they offload that for a third party, and it's quite expensive. But by doing both at once, again, will save the county a lot of money. I think it's about $11,000. So we're kind of waiting for that. So that's going to be like another week or two before that data is extracted. But it is moving along. The other thing, CMH, you've heard over the months, several months, I've talked about the wait times in the parking lot. We've worked with the new administration at CMH, and I'm happy to report that as of Friday, we've announced that there'll be no more waiting times in the parking lot for ambulances. EMS will be given priority in the ER, and will be brought in, and the patients will be offloaded as reasonably as can be done, so we can turn these ambulances around. I'd like to give my hats off to CMH administration and Dr. Weisberg and the ER for working with us to change this procedure. So it's going to benefit the residents of the county a lot.
Excellent.
Great.
Good.
That's it.
Any questions? Thank you.
Thanks, sir.
Fire?
George isn't here, but he's got 2 requests.
All right, resolution to appoint Rustin Dolan of Alaska Fire Department position of Deputy Fire Coordinator for Battalion 4. This position covers Scottsville, Stockport, Stuyvesant Falls, Kinder Appalachian, Chatham, Denton, West Kent Fire Districts, or companies. This position is open due to a resignation.
Move it.
Second. All in favor?
Aye.
Opposed? It's okay. To appoint Wayne Gearing from the East Chatham Fire Department as Deputy Fire Coordinator's position to oversee curriculum development for fire training classes and assist with public education in regards to fire safety. Second. All in favor?
Aye.
Opposed? Okay. Appoint Brandon Gaylord from the Chatham Fire Department to the office roster of per diem fire service instructors.
Second.
All in favor?
Aye.
Opposed? Okay. Thank you, George.
Good job, George.
Mr. Harrison.
We have our report that we submitted, and we're moving forward with COAD and threat assessment meetings. We're moving along is actually faster than we thought they would. Both going to be good programs. I did submit a formal request to extend the hazard mitigation grant program. Like they said, they're not allowed to do that, but suggested maybe we go to FEMA, and they said, the way that it's read, FEMA's not allowed to do it either, so there's no extension, they turn it down. It doesn't, sounds like they can't do it legally. So we're moving forward with the update, which is can take up to a year. Rob, gonna hire a consulting firm, as you know, for last month, we worked group for the grant to update it. So we're moving forward with that. I have one member out at the Lyceum Conference and Circuit. No resolutions, and looks like you probably heard it, that estimate is winding down on its COVID efforts. This is how
And
it's
the
gonna
FEMA
peak
money,
every
too.
winter, peak every winter, we're going with it.
I think you're probably calling all the supervisors, right, to wrap up any FEMA monies that they were. If you don't get it in soon, then they'll send you, or
Yeah.
you're not interested, they'll send you a form that you sign to say that I'm not doing this meeting. Any questions? Thank you.
Thanks, sir.
So since we did this so quickly, and I want to keep you all there for another 2 hours,
8 o'clock.
You're right.
As long as we're out by 8.
we don't have to discuss this, all of this tonight, but I'll just bring it up. We got a email from John Riley, and based on the request of several residents and supervisors, we would ask the public safety committee to revisit the bus cameras concept. Knowing the administrative and enforcement concerns may remain, the concept is growing in popularity, and residents of bordering districts are concerned that cameras are being turned off as buses enter Columbia County. I copy the company above and appreciate the consideration, John Riley. So this was discussed, a bit ago in reference to, there's a company that will actually put cameras on the buses. It's free to the county. And I think we discussed it. But they unfortunately find one at that time. It was discussed and
The biggest thing there is there's no enforcement
correct.
capability, correct? I mean, if they just ignore it, then
Yeah, it's basically us sending out letters or, saying,
you violated. Please pay this fine.
So I don't know.
and then the other issue is you have to have someone administratively sending those letters out. Right. That's something we may choose to want to do, but, I think that's what the major expenses for, say, Dutchess County, who came and presented it last summer. Correct. But I think it's something that's we can revisit it, maybe have another conversation with Dutchess County.
Do we have
something the committee wants to pursue, or is there any?
do we have an idea of what the cost of the county would be administratively, or I guess it would depend on.
I mean, obviously Dutchess is a much bigger county, but we could probably extrapolate an estimate from what they're doing, based on our size.
Just get an idea of what the cost would be.
Problem is, it's just not enforceable, right?
It's not.
That's a good problem, so
But
one of those things, what are you gonna get, how much are you gonna get out of it?
Well, it's like the honest people who will pay their fine and do what they have to do.
don't advertise. That's
Well, the other issue is you have, short staff at the sheriff's department, so even if we were trying to chase some of these things down, it's not gonna happen, so.
I don't think we could even chase them down. What they're saying is no enforcement.
Right, I'm just saying like, whatever.
It's a letter and how much do we get, what portion do we give of that? I mean, do we know the breakdown of that?
I'm not sure.
50/50
I'm not sure what it
It's,
is.
I thought it was 25.
it's,
That's what I.
it's according to what they write, it's like, it's very convoluted, and more of the fines are going to the state surcharges, so I don't, it's according to what they're actually writing them for.
But the camera company would get a percentage.
Correct, so it's not revenue generated by any means.
I mean, it's something we could do and cover the cost of the administrative cost. Anything's better than nothing, I guess. But yeah, that's my mind. If it's not gonna cost us anything, then I mean, if it stops one person from passing a school bus.
You wanna
then
have them come again and present one more time?
Yeah, that would be,
Maybe just to this committee.
Yeah,
just this committee. Yeah, then we can ask all these questions and. And we
I
can
mean,
determine.
it is a safety issue.
Yeah, it is, definitely.
People pass buses all the time.
Why is it unenforceable for a vehicle traffic law?
Because it's under a local law.
Camera's good enough so you can see the operator.
is there something specific about the way that they enable legislation for these specific cameras? That they basically said that it goes to like a special court, and then that court has no fiat.
I don't think they were writing,
So it's,
they're not writing it under the vehicle and traffic law.
No, it's under the local law.
Under a
The
local
video
law.
could be used.
Right.
Be used in, prosecution of a
Correct.
But, I mean, I guess you're offering them either you do it this way, or we're gonna give it to the sheriff's office to, you know, conduct the traffic.
That's why I was saying chase it down, you know, if it was gonna be written under vehicle and
And
traffic
the
law.
problem with the cameras the problem with that is you have to be able to identify the, to operate. You can't just write a ticket.
I had there's some individuals that came to me that wanted to put cameras up throughout the county that would read license plates, and that would also then do its own research or go back to a database to say this is a person that is at high risk of whatever, maybe terrorist act. Then it would go to the sheriff's department. Well, that, you know, how would you ever catch that?
I think we need to look at all the.
Yeah, I think it'd be good to just bring it to the.
Yeah, I think
Why don't we bring it back to the committee, have another conversation, and then we can make a decision, maybe something's changed.
The person that came and met with us last summer was the chairman of the legislature in Dutchess County.
Right. But maybe them again, or I think the company should come.
Or both.
Or both. Yeah. Okay. That's all I have. Is there anything
What,
else?
when do you want them next month? See if they're available next
See if they're
month?
Yeah, they're
Next
available.
month.
If not. Anything else for the committee from anybody? Anybody from the public?
Mostly.
Motion to adjourn?
Second.
All in favor?
Aye.
Opposed? Okay, thank you, everybody.
Thank you.